My first patient that I ever saw with a heart attack was at the West Roxbury VA. I was a medical student. It was my second clinical rotation ever. The first patient I ever saw in that much distress. I walked into the emergency room, and my resident was standing there, and he said, "I have to go place a breathing tube into someone right now. It's all you with that patient. Get in there and see him right now." So I run into the patient's bed, and I couldn't help but thinking, this is a powerful man who has probably never felt this weak in his entire life. He was sweating. He was as red as his hair was, light-skinned man, red as a beet. He was breathing heavily, saying 2 or 3 words in between each breath. I walked up to him and I said, "Sir, how are you feeling?" "I'm a med student." And he goes, "Doc, I've never felt this bad. Actually, I did feel this bad once before. It was in the Korean War. It was during Operation Killer." I was like, wow, Operation Killer. That exists, by the way. I looked it up on Wikipedia right afterward. And I said, "Tell me about that." He goes, "I was in the U.S. 2nd Infantry Warrior Division." And he starts to describe the people that he was in combat with. Incredible people, really just selfless. Went into service right after college, right after high school. Did nothing but wanted to serve their country in this time. He then started to get into some of the stuff he was doing in Operation Killer, and I realized I was actually starting to sweat, and my face was probably turning red. And I said, "Sir, I think we have to get back to your chest pain. Tell me what happened." He goes, "Well, I was in Providence with my wife." And I said, "Wait a second. You were in Providence? That's an hour away." He goes, "Yeah, it actually took me 90 minutes to get here." I said, "Are you telling me you drove all the way here with deep, burning chest pain to get to this hospital?" He goes, "Yeah, this is my hospital. I just moved there and I don't really like it." And I said, "Really, sir, why didn't you go to your local hospital?" And he just grabs me by the arm and he says, "This is where my family is. This is the only place where I trust my doctors to give me the best care. I would never go anywhere else." And so I learned that the VA at that time was providing amazing care for that veteran. And at that moment, which I will never forget, the West Roxbury VA in Boston was the emblem of the patient experience for me. A man who was clearly having a heart attack. By the way, he had had one before. So he knew what was happening. And he decided to drive 90 minutes, knowing that he could die, just so he could get care at the VA. This is when I knew that there was excellence all over our health system. People come to the VA for the right reasons as employees, and they come to the VA because we have the best patients in the world. And then 2014 happened. You had everything, every news channel you could think of. I was a resident at the time. I was at Johns Hopkins. I remember just seeing, because we don't really watch TV, we have no time. But just walking by, seeing CNN, Phoenix VA, lied about wait lists, veterans dying on wait lists. The VA is failing veterans. And I told myself, that's not right. That's not the VA I know. That's not the VA I trained in. And when I got to the VA as a White House fellow, I knew that there were opportunities that the VA could offer to itself. There were pockets of excellence everywhere throughout the country, but we are as bad and are as held to account for the worst facility in our system. We are as bad as our worst, and we needed to change that. So throughout my fellowship at the VA, I was known as the Shark Tank guy. We set up an operating model to spread best practices, had a clear process for doing so. I put in all of the great stuff I learned at the Armstrong Institute at Hopkins into this around quality improvement, around actionable measurement, around doing everything we could to make sure that we were scaling the right best practices and finding them. We had subject matter experts both inside and outside the VA looking at them. And yet I was only remembered for just one small part of what we were doing, which was the Shark Tank. We had people throughout the country, frontline employees who had contributed innovation, coming and presenting their best practices in clinical care, administrative operations, and whatever it might be to improve the veterans' experience in a virtual environment, presenting their best practices to every single medical center director in the country. They were able to see the great work that these people were doing, and they were bidding their own resources as medical center directors to put all of the resources needed to get the projects completed and improve the quality of care. And then I was wondering, why does everyone just associate me with this one event? And it's because I realized that the VA is one of the most innovative organizations in the world. In fact, Reuters identified it as such already. And this was a way for the innovative spirit, the reason that people come to the VA to work there, be they clinicians or be they any other type of employee on the back end doing administrative work, they come for the mission. We've set up systems in the VA now to understand exactly how people are progressing with spreading best practices. This is one best practice that was a simple one that involved changing our systems to allow veterans to directly schedule their appointments in either audiology or optometry. And you saw how swiftly this was uptaken in the system. And we knew exactly how far each player was in implementing their project throughout the country because we had a standard platform where everybody was entering their improvement projects. And I could elevate structured implementation data on all of the projects that we had. So color-coded, the darker the green, the better you are off and the farther you are along. Dark green means sustainment, a little bit lighter green means the project was completed, all the way just to in progress or in planning, which is orange. We know exactly how far along people are with implementing their improvement projects with this system called diffusion of excellence. We could also see the volume of projects being uptaken by people throughout the country. So we had 10 to 13 best practices per cycle of about 6 months, where we said we are investing all of our operations, all of our attention, our focus, and spreading these best practices in clinical care. And the bigger the circle here, the more projects these facilities took on. And you could see that basically every single medical center in the system was involved. This was a new level of change, a new endeavor in innovation that involved leveraging the scope and scale of our system like we've never seen before. And even though we were able to write a JAMA article about it, and we got a lot of attention for the diffusion initiative, I'm still known by a lot of people as the Shark Tank guy. Everett Rogers introduced this concept of understanding how swiftly and effectively innovation spread. He worked with farmers. He came up with this graph. He described characters in the diffusion of best practices world, everyone from innovators all the way to laggards. Your innovators are the ones who are constantly experimenting and discovering new ways of doing their work. In this case, it was hybrid seeds, mixing different types of seeds to generate more productive plants and crops. The laggards were equivalent in the medicine world to the people who needed 3 meta-analyses to change the way they practice medicine. These are the people who needed to go to trade show after trade show, and they still weren't convinced if this was the best-selling hybrid seed on the market because they knew what they were doing works. And so you have all the characters in between, your early adopters, your early majority, and your late majority. With this initiative, we were able to replicate the Everett Rogers curve. We saw that there was an initial spark in the number of facilities who were adopting these best practices, a plateau and then a decline over time, with the same characters involved throughout our system of 300,000 employees. To be able to see this phenomenon in action in a way that we knew was benefiting veterans was one of the most rewarding experiences I've ever had in the VA. But we weren't necessarily including this in the normal business of what we were doing just yet. These were the people who were choosing to adopt these best practices, probably penetrating maybe 5–10% of our employees. There's something that all these pictures have in common: a fern, a snowflake, and a lightning bolt. They're fractals. You can describe fractals mathematically, but basically they're self-similar structures that when you put them together, they all look like each other, and they build higher level structures, larger structures that look like the individual units that comprise them. And at the end, you get something beautiful in nature. But guess what? You can do fractals in organizations as well. We have committees now set up in one of our networks that look exactly like each other at every level of the organization. And the purpose of these committees is to do one thing only, which is to empower frontline improvement teams in their improvement work. To make sure that the biggest priorities for improvement were being uptaken by empowered teams formed for particular reasons. This is an example for ambulatory cardiology care quality that we've already had. You had metrics that tell you our outpatient care in cardiology isn't quite up to snuff. You have 2 integrated project teams set to solve both the quality issues and the patient experience issues. Those are elevating concerns to a committee above the committee at the facility that looks exactly like the one below it, with full representation from all of the units below that. They're providing help in terms of detailing a service chief from another hospital. That committee then elevated a different concern up to the national office for us to send our experts in to focus on the patient experience. And at the end, it's all about the frontline team setting goals, targets, and timelines for their metrics. And guess what? All of the best practices that we're trying to use are coming from the vast database of best practices we solicited from the Diffusion Initiative. This is really beginning to change our operations in a way that, again, leverages our scope and scale. In our transparency efforts, we have the outpatient compare data for Washington, D.C. VA Medical Center as an example. We have all of the HEDIS metrics, thank you, NCQA, that we just got. We purchased them, and we're able to compare our performance with that of the regional community in a diligent way. What we're trying to do is take that to the next level. If you have information on quality and access that you're being very transparent about, and you're bringing that information to your veterans, and you're telling them by service how long it's going to take to get your next appointment and what the quality is of your next appointment, you can optimize for all of those variables. At the risk of being sued, I'm using Waze as an example, because I enjoy the application. But the idea is to empower veterans with better decision making, to understand where they should go and what they should do for back pain, one of the most nebulous problems, yet simple and common, that we have. Who do I see for back pain, and at what time, and for what type of back pain? We can tell you that you should probably see your primary care doctor first. That'll take 5 days. Then you should see a physiatrist, another 4 days to see that person, optimizing for access. And then you might see physical therapy based on that physiatrist's recommendation, and then finally, you'll get relief in 6 weeks after the physical therapy. If you are able to construct everything that we have in terms of our performance, leveraging our best practices to optimize that performance, and then allowing the veteran to be able to see where they need to go, what step they need to take, and where their destination is, then you will have revolutionized information access to your patients. And we have the ability and the responsibility as a public health system to deliver this type of transparency to our veterans. And that is the next frontier that we're undertaking. Thank you very much.